Riverside Healthcare puts the health and wellness information you need well within reach.
Welcome back to the Well Within Reach podcast. I'm your host, Helen Dandurand, and today I'm going to be joined by Dr. Nibby Matthew, family medicine provider at Riverside's Frankfort campus, to talk about primary care.
Healthcare can be confusing, but thanks to your My Riverside MyChart, you can easily manage not only your care, but your family's as well. With a single click, your My Riverside MyChart lets you stay well connected to the same information your provider sees. You can view your health history, get test results, request prescription refills, pay your bill, or make an appointment. Manage your care from anywhere, your laptop, phone, or tablet. Learn more and enroll today at riversidemychart.org.
And we're back with Dr. Matthew. Thank you for joining me today. We're glad to have you.
Thank you. Great to be here.
Yeah. So can you tell us a little bit about your background?
Sure. Well, I was born and raised in New York, and in about 2006, I moved to Chicago for medical training. After about 3 years, my plans were to go back to New York. However, I was offered a great teaching opportunity in the city and decided to stay in Chicago. Shortly after, I met my husband, who's born and bred in the south side of Chicago, and that's how Chicago became my home.
You're here now.
Yeah, we live here now. We've been in the city for several years now. After having our boys, we decided to move to the southwest suburbs just because the schools out here are better, and we thought this would be best for our kids. So here I am. And then I was fortunate to find Riverside and joined on in August of 22.
Well, that's awesome. We're so happy to have you here
Thank
at Riverside. All right. So we're talking today about primary care. Can you tell us what is a primary care provider?
Yeah, that's a good question. So primary care provider, or you might see it or hear it as PCP, is basically like the first contact an individual has with the healthcare system. I think a good analogy is they're basically like a healthcare manager. So the goal of a primary care provider is to help an individual live a healthier life and promote better health.
That's awesome. So there are different kinds though, right?
Yes, there are. So the primary care providers fall under family medicine doctors. There's also internists, pediatricians, and then there are obstetrics and gynecology, basically OBGYNs. So the family medicine doctors, the unique benefit is that we can care for your whole family. We see babies, children, parents, and grandparents. No matter who is sick in your family, you have one person to call who knows your family history and can provide highly personalized care. Internists, they are trained to treat both simple and complex conditions from early adulthood through old age, so they don't see children. Whereas pediatricians specialize only in caring for children from birth through early adulthood. And then there are OB-GYNs, which a lot of people don't think about as being a primary care provider, but they are, and they're experts basically in women's health, specifically female reproductive health.
Awesome. That's great to know just what each one is. I think sometimes you hear things like internal medicine and you're like, I don't know what the difference is there. I just know I go to the doctor.
Yeah.
So that's awesome. So why do you think that it is important for people to have a primary care provider?
Yeah. So as I mentioned before, this person is your first contact within the healthcare system. It's basically your point person for health and well-being. You would come to someone like me for common illness, like a common cold, sore throat, leg pain. I would also be able to help you manage chronic conditions like asthma, COPD, blood pressure. We also would provide preventive care. So this is when you come in for your annual physical, and we basically go through all of the preventive and screening measures that are based on age and an individual's family history. And then we can also help with early detection with illnesses or certain conditions like cancer. In some situations, you may need to see a medical specialist. So this is an expert on a specific area of the body. And at times, we would give you information on who to see for that. But, overall, research shows that having access to a primary care provider directly favors and impacts good health and wellness outcomes. And if you need more specialized care, as I was saying before, a certain health condition, we would guide you to your next steps and connect you with the right specialist.
That's awesome. So it's really just a home base, the person that you go to when you need to know, where do I go next? What do I need? Do I just need medicine? Do I need to be referred? What's going on?
Yes, the goal is we want to identify health issues earlier. We want to keep you healthier, happier, and try to save you on money for medical expenses. We don't want to exhaust the ER staff as well as urgent care facilities if possible.
Yeah. So what would you say to younger people who are like, I'm not sick often, I don't really need a primary care provider? What would you say about that?
I think I get that question every day, or that comment every day. It's important to start this early detection screening earlier on because we're trying to be proactive. So we want to detect disease before it sets in. And it also allows an individual to take on responsibility for their medical health.
Sure.
I think it's horrific when a patient does come in and they have advanced disease, and we know that it could have been avoided if they started a screening or even just seeing a regular doctor from right after college. I think that would be best. And hopefully, when the younger population, parents are usually more responsible for bringing a child in for their annual physicals, sports physicals, things like that.
Right. Of course. That totally makes sense. We're going to take a quick break to talk about finding a primary care provider. Riverside knows that health is your greatest asset and that your primary care provider is your partner in health. Find a primary care provider that fits your needs at riversidehealthcare.org/primary care. All right, and we're back. So what would you say is your favorite thing about being a primary care provider?
My favorite thing about being a family practitioner in primary care is developing these relationships, the bond within a family. I love being that one trusted source for an entire family's healthcare needs. I love communicating with patients of all ages, from toddlers to elderly. And I also love the versatility. I get to treat the common colds to chronic conditions and even performing minor procedures like IUD insertions, joint injections, skin biopsies. And, as a full-time physician and mom with limited time, I love that I can take care of multiple family appointments on the same day. So that's why I chose to be a family practitioner in primary care.
Wow. So what things would you tell people to keep in mind when they're choosing their primary care provider?
Yeah, I think this is a very individualized answer. So I think it really depends on what you want from your doctor. I think in there you want to find someone that you can form a connection with, that you can trust. I think, medicine can be scary, disease can be scary, and you want to know that you can rely on someone. They're going to give you their honest truth and treat you as if you were family. So you want to feel comfortable with them. And also, I have a lot of patients that they tell me that they're afraid to express their concerns and fears because of judgment or some comment that I might say. But that's really important. You want to be able to make the patient feel comfortable and tell them, like, hey, listen, your concerns and fears and thoughts, they are important to me. And let's work together as a team and figure out what we can do to move forward. You also want to find a primary care doctor that's experienced and has in-depth knowledge. You can rely on them. They're using evidence-based medicine. They're up to date with all of the medical journals and data. You also want to find a doctor whose location and office hours are convenient. Lastly, we don't think about this, but a reliable office staff. That's really important. You want to make sure that you can connect and talk to the nurses and the front desk and receptionists because they play a key role within the medical team.
Yeah, you want your whole team and experience to be with it and to know what's happening and for things to go smoothly. And then on top of that, like you said, someone that you can talk to as your provider and that experience and that knowledge. That's great. How can people go about finding the right Riverside Medical Group primary care provider for them?
Yeah, so you can go to riversidehealthcare.org/primary care and find a provider. You can look through their provider profiles, and each profile does have a video to get to know the providers along with clinical interests, specialties, and bios.
That's great. So you can go in there and see who you might match up with, see who might be a good fit for you. It is such an important choice to make. And like you said before, even as a young person, if you don't feel like you need to have that person, it's great to do the research now when you can and just have that trusted source as a lifelong person. So it's really great. Thank you for being here today.
Thank you.
Yes. And thank you, listeners, for tuning in to the Well Within Reach podcast, brought to you by Riverside Healthcare. For more information, visit riversidehealthcare.org/primary care.